Good afternoon, everyone, and thank you for joining our webinar today on introducing students to the real world of healthcare management with the Navigate scenarios. My name is Suzanne Walker, and I'm the Senior Marketing Manager for Public Health and Health Administration here at Jones & Bartlett Learning. For those of you who are not familiar with Jones & Bartlett Learning, we are a provider of instructional, assessment, and learning performance resources for the secondary, post-secondary, and professional markets, and we specialize in the areas of health and safety. So let's jump right into today's agenda. We're going to begin the webinar with an overview of the Navigate scenarios, so you have a better understanding of what they are, what courses they're available for, and whatnot. Then I'm going to turn my presentation over to my very capable colleague, Stephen Webster, who's going to give you a quick demo of the Navigate scenarios. Then we are very fortunate today to have 3 current users of the Navigate scenarios who are going to share their experience using the Navigate scenarios at their schools. Then I have some student feedback to share. Last month we did a survey to a number of students who currently or have used the Navigate scenarios and got some great feedback, which I'd love to share with you. And finally, we will be taking your questions. So that's how the day or the presentation looks. So what are Navigate scenarios? Navigate scenarios are a virtual learning tool that exposes students to a variety of day-in-the-life career experiences. Through immersive learning simulations, students develop the critical thinking, problem-solving, and communication skills necessary to apply their knowledge to situations they'll encounter in their future position as a healthcare professional or administrator. Each episode will walk students through a virtual world where they will apply their classroom knowledge to make real-life decisions as a healthcare administrator or other healthcare professional. And along the way, they'll interact with colleagues and patients to practice learned skills in a safe environment. So there are 8 different scenarios currently available, and you can see here they range from healthcare delivery, finance, ethics, law, healthcare marketing, human resources, policy, and organizational behavior. Here you can see this is another view of them. Each Navigate scenario really corresponds with different courses in the curriculum, and they're very much aligned to those courses and to our best-selling textbooks. So they really pair nicely with a text. Each scenario is divided into 4 episodes, and those take about 45 minutes to an hour to complete each episode. So all of our scenarios, like I said, can be easily bundled with a Jones & Bartlett Learning text, and we tried to make it very affordable, so it's only an additional $15 when bundled with a text. They're also available for standalone use or, for use with competing texts. And the price for a standalone use of one, like say healthcare delivery, would be $49.95. And that's the whole scenario with the 4 episodes. Also, we can customize a scenario, so you can bundle 1 or 2 episodes from one scenario with 1 or 2 more from another scenario, if that's something that works for you in your course. So a couple of other noteworthy features. The scenarios are all created using HTML5 versus Flash, which is a welcome change. They're all ADA compliant, which this day and age I think is highly important. Each scenario has built-in self-assessment quiz, which gives students immediate feedback, and also includes some writing opportunities, which can be which instructors can assign. Finally, it's mobile and tablet friendly, which enables students to use them how, where, and when it's convenient for them. So another feature of the scenarios is that there are transcripts included within each scenario, and those offer storyline summaries, which basically overviews the scenario, setting the stage, so to speak. There's also a detailed character list that explains who each character is and what their role is. There are episode overviews, which put each scenario into context. And then learning outcomes are addressed, and there's also answers to the assessment quizzes. So now I'm going to turn things over to my very capable colleague, Steve Webster, and he will be able to share his screen with us.
Are we seeing the introduction to the scenario now?
Yes, we are, Steve.
Yes, we are. Terrific. All right. And one other capability I need to turn on is since we have sound, we need to turn on my sound, which seems to be a bit of a problem here. So we're actually going to go on without it because we can actually turn on closed captions. So we're going to turn on closed captions. We're looking at the one of the episodes, which is called Expansion in the healthcare delivery scenario. And at the beginning of all of our scenarios, we have a scene setting introduction, which sets the stage for the work that the students will be doing. And we set the stage here, and we're talking in this particular case about potential expansion of the facility. And we click on continue, and in this particular case, the task is launched via an email from Tanya about a new project. And here is the email. And this is actually, of course, a faux email that you read as a student. And the task is laid out in front of you about gathering information from the staff of Bright Road around looking at the growing market and determining the cost and risk of adding home health care services. And Tanya has suggested a group of people that you are going to want to have a conversation with. And she's going out of town, and good luck, and good luck with your project. And so we're going to close this email, and we're going to load up the scene, which is comprised of backgrounds and live actors playing and reading their roles. And you'll see here when the scene loads up, you'll see how all that looks. And we're going to start our conversation with Kevin Stewart, the marketing director. And I'm going to turn on the closed caption. Apologies that you can't hear this. So there are various responses to Kevin, and you get to decide how you are going to respond. And if you pick the right choice, you'll get a response and then moved on to the next choice. If you pick the wrong choice, which I'm going to do right now, which would be the response 1 here, and you're going to get a response from Kevin. My closed caption went off again. And now we're back at that same moment. We're going to make the right choice here, which is the third choice in this case. So this is a good point here to point out that when you're in the scenario, you have a menu of choices, and you can see the various scenes that we are working with. And you can jump into various scenes if you want to take things out of order. Of course, the students are not recommended to do that. There's also the transcript that Suzanne mentioned earlier, and I'm just going to pop that open here. And here is that transcript that Suzanne was talking about, with all the characters indicated and where they're meeting and the various scenes and the whole script. So it's a very nice, tidy package where you have all the information regardless of how you want to consume this stuff. So the fact-finding mission goes on, and you have a meeting with your mentor, you have a meeting with the marketing director. I'm not going to go through all of the process of walking through all of these meetings, but you're going to work your way on through You're going to have the last scene here. We're going to jump ahead to scene 6, which is an analysis. We are going to be meeting back in Tanya's office, and we're going to talk about the Medicaid audit. And here are your responses. After you've worked your way on through the scenario, you get down to the assessment, where there is a 10-question assessment. And I can never remember all of the answers, so I'm just going to make some responses. I'm going to get given a response immediately about how I did with my questions. And as usual, I'm not doing all that well. The student is able to take the assessment as many times as they would like. So it is not one and done by any stretch of the imagination. Hey, I got one right. Which is, of course, why you want me nowhere near healthcare. Thank you very much. I'm a technologist. And I got a whopping 10%. When you are finished with your assessment, you can save the results, which kicks out a PDF, which you can view. And it will tell you, it will show you which scenes you have finished, and it will give you your assessment results. This is a very tidy package that you can have your students deliver to you to prove and indicate their completion of the work. Flip back over here to the program, and we're going to continue on to the recommendation. And this is that writing assignment that Suzanne referenced. In this particular case, the chore is to write a recommendation about whether or not the organization should expand. So you are going to write an email, 250 to 500 words, offering up your recommendation from the results of your interviews. And this is a faux recommendation. So this is not a true email. So this is not actually going out through an email server. So you're going to say, according to my findings, and then you would compose your whole email. One suggestion that I have, and I'm sure some of our instructors will point this out, that when there is an assessment or a report or a recommendation, no doubt you don't want the students to be kicking that out as a first draft right off the top of their head. They may want to write that in a word processor where they can edit their work and provide lots of cogent and well put together thoughts, and they can always paste that in. This brings me to another point, which is that you can leave the module and then come back, and you'll be able to pick up where you left off. So when you send this email or this quote email, if you hit send, you are going to be given this, again, that opportunity to save your results, and that's again as a PDF. And here is that PDF showing the scenes that I've seen, the assessment results, and now here's my recommendation. Again, this is what you would want your students to submit to you to show that they have fulfilled their obligations and have done the good work that you want them to be doing. One of the last things I'd like to offer up, I heard this as a suggestion some time ago when I was demoing this to some other faculty. They had a nice recommendation about how to use the scenarios. They suggested having the students both do the work by themselves and then breaking the class up into small groups and then having them collaborate to put together a collective assessment and a collective set of findings, and then going yet another level and having those small groups present their findings to the class. And that was, I thought that was a pretty novel approach to how to do this stuff, and really emphasizes the collaborative work and being able to work in a group. So I think that's about it. I'm going to turn things back over to Suzanne.
Okay, great. Thank you, Stephen. That was great. So now we're fortunate to have 3 instructors who are going to share their experiences with using the Navigate scenarios. And to kick things off, we have Dr. Michael Leisure, who also happens to be a Jones and Bartlett Learning author. And so I am going to turn things over to Michael.
Thank you, Suzanne. Welcome to everyone this afternoon. I am currently an associate professor and assistant dean at UTMB School of Nursing in Galveston, Texas. And I also serve as the track coordinator for our Master's in Nursing program track, the Executive Nurse Leader. And so I was introduced to JBL. I haven't been in academia for that long, and I was introduced to JBL when I began working with them on the textbook that I authored or edited for JBL Learning. And so when this opportunity presented itself to me, and as I assumed the track coordinator role, I saw that it was a great fit. Next slide. So why did I choose the JBL scenarios for my nurse leader track? And number one, we are 100% remote learning. We only meet twice as a cohort, and that is for a live orientation. Well, up until 2020, it was a live orientation, and then we meet once at the very end of the program when the students are responsible for presenting their practicum projects. This was also the largest cohort of incoming students in the ENL track. We had 22 this time, which may not sound a lot for people who are coming from nurse practitioner tracks. But when we were normally working with 7, 10, 12 students, having that many was going to pose a challenge, because in the past, this was my first time to teach this course. And I noticed that looking at previous times this class was taught, there were a lot of essay writings and lots of discussion board activities. There was very minimal team group work, and I had to figure out a way I wanted really to engage the students in the learning. And so in this particular class, it's our graduate course 5327. It's Transformational Healthcare Leader, and it's really the foundation of the ENL track. We introduced the leadership and the management principles, and we really focused the students learning on how to lead change, how to identify their own vision, and really recognizing that there is a difference between leadership and management, and then how to focus on that leader and on the teams that they are leading. And so what we did was, as we purchased as a package all of the scenarios, but I wanted to strategically utilize the scenarios based on the objectives for the courses that we're in. And so the students purchase the package, and they're going to use this throughout the ENL track. So for this first course, we chose episode 4, leadership of the organizational behavior and leadership scenario, and we chose customer satisfaction from the healthcare delivery. And again, those others are going to be placed in other courses as they relate to the objectives for those classes. Next slide. And so one of the things that's very important to me as an instructor, my past life before academia was hospital operations, healthcare operations at a senior executive level. And it's great to understand the theory. It's very important to understand the theory. It's absolutely important to know the concepts, but it's about application of the materials. And so one of the things that's important to me, and Steve, you kind of stole my thunder, but that's exactly what I did with the scenarios, is that the students were responsible for individually watching that episode and then doing that assessment at the end of each of the scenarios. And then I established some individual discussion board posts where the students posted their individual results and talked about the opportunities that they identified after doing some reflection. And that allowed other students to also come in, and they shared their responses and they shared their assessment findings. And it really opened up a dialogue for some of these, and that's the other thing, is that some of these students are currently in management positions and some of them are not. And so it allowed for those who have more experience to share those experiences. And then we took it on to a group activity. And those groups were to identify top three takeaways from the activity of all the members. And this led to some debate, which was very good, healthy discussion about why those three takeaways were identified as the most important as a group, because we know that healthcare is about groupthink and group work. And then you had a group discussion board where you had to post those key takeaways from the activity, why you selected those top three takeaways, and then again, it allowed for the others the other groups to come and look and compare and contrast why those takeaways were identified as the most important versus others. And finally, the students were able to discuss real life experiences of a situation or event where the scenarios were something that they had actually observed or experienced in their time, and they were able to compare that to something that they had personally experienced or personally witnessed, and then what those takeaways might have, how, if they had implemented those takeaways, whether it was in the scenario through the JBL series or if it was in the real life scenario, how could have implementing some of these ideas resulted in a different outcome. So I too did a survey of my students after implementing this for the first time, and the commentary was incredible. So I am very excited to continue incorporating these scenarios as we move forward and continue using this as a part of our foundational teaching objectives for the ENL track. Thank you, Suzanne.
Thank you, Michael. That's wonderful. It's wonderful to see that level of collaboration in a mostly remote course. So thank you for sharing that. It was wonderful. So moving on, we have Dr. Linda Martinez from California State Long Beach. Tell us a little bit more about your program and experience with the Navigate scenarios.
Sure. Good morning, everyone, or maybe good afternoon in some places. Yeah, I have been using the Navigate scenarios now for, I think, probably 3 or 4 years. Whenever they first came out, and we had a great rep when the days when we still had reps that came to you, came to visit you, and they showed me this, and I thought this was a really good idea because I've been looking for something to introduce the students to kind of a virtual internship, basically, so that they would have the opportunity to interact, and before they actually go out into the real internship, that we have in our program. So we stumbled on this Navigate scenarios, and the format is really great. The students are able to watch it. It's entertaining. It keeps them it doesn't let them just kind of sit and listen. You constantly have to click on something to keep moving through the program, even if it's the choice you make, then the next choice, you have to make the next choice also, because there's really no wrong answers. So it really works well. I think it keeps them engaged and keeps them constantly thinking. I tend to want the students to think outside the box. And so they have to not just listen to what's going on, but then think about it logically. What else could they do? What else could they say? How could they fix some of these situations that are posed to them? So what I typically do is the students are given one scenario for each of the 4 Thursdays, and they're given the class period to complete it on time. Now, this is when we had face-to-face. COVID has kind of thrown a wrench in my plans, but we're operating through Zoom, so it's a little bit different, but they still get the opportunity to have that Thursday off to work on it, and then they have until Thursday evening to turn in the scenario. Now, the answers to the scenario. Now, they can start working on it earlier in the week or whenever they find the time to do it. I don't lock it down. They can do it whenever they have time. But the answers are typically due on Thursday night. Now, what they submit to me is the Adobe PDF that has the answers to the multiple choice questions. They get credit for doing it, regardless of whether they got them all right or not, because they're going to do it until they get them all right. Rarely do I have a student that just turns in the first try where they've got several of them wrong. So I just give them credit for completing it. Okay, next one, please. Now, the email, I found that the email with just the 200 words or 250, whatever the cap is on it, is just not enough, because I've turned this into a writing assignment as well as an assignment on thinking and how to answer the questions. So I have them answer it in a Word doc, and they have to give more than that. They have to get up to about 500 words. And it has to be grammatically correct. I usually require them to have resources, so it's APA formatted. So it's not only an exercise in looking at what they should do to fix the situation, but how they should write. I teach healthcare marketing, and these people are going to go out and, you know, be leaders in the healthcare world. And so they need to know how to write. And I think it's really important that they do all the common courtesies that go around along with it, like thanking the people for allowing them the opportunity, and for the writing part of it where their grammar is correct. Okay, some of the benefits I found was that they learn to use it, how to evaluate situations in a real life situation, rather than me giving them a case study and them sitting around thinking about it. It's actually more engaging. They do get practice in the APA and the writing skills. And the good thing about all this is that at the end of the semester, when they're given those eval forms on what they thought of the class, usually at least half of them say they really enjoyed doing the scenarios. And I think, let's see, that's it for me, right? But anyway, I think it's really worth the time and the effort.
Wonderful. Thank you, Linda. It's really interesting to hear how different people are using them. And so I'm equally interested to hear about Dr. Wallace's experience with the scenarios and the episodes that they use with Colorado CSU Global. So Arletta?
Thank you, Suzanne. We are a 100% online university. Everything is done online. We wanted to provide experiential learning to our students, and we tried that in a few classes, but because our students are global, they're everywhere, there's not always the opportunity for them to go into that situation within a healthcare organization or facility. So we were introduced to the Navigate scenarios in fall of 2018. We implemented them into our graduate program in 2019. We did initially add it as a reference or a resource in a specific module, but we found that all of the students weren't participating. So we changed that to attach it to a measurement. So it's either part of an discussion or part of a learning assignment. But the students really enjoy that interactive content, and it is as similar to an experiential learning as we could get. Also wanted to make a point on the closed captioning, and the transcripts are wonderful for our compliance. I mean, that's a huge plus for us with using the JBL products. Next slide. So far, we have it in all these graduate courses. Some of the courses we utilize 2 of the episodes, others we utilize 1 episode. But I'm looking to change that up a little bit as we go into a new revision cycle at the end of this year. But our students are very pleased. It's very affordable, and it's added a lot to that simulation, that interactivity of the students, and we've gotten very positive feedback.
Wonderful. So thank you to each of you for sharing your experiences using them. I also wanted to share some feedback from a recent student survey. We did a survey back in, I guess, about a month ago with about 4,500 students who had used one or more of the scenarios. And we were really gratified by the response, particularly how they rated them. For required materials, I think it's pretty telling to get 4.4 out of 5 stars. So we were really pleased that they were enjoying them so much. We also wanted to know a little bit more about how they were using them. And so 96% had said that they completed the multiple choice assessments and handed them in. And over 2/3 said they had completed the written assignments. And the greatest strength that they identified really in using them is just really applying the concepts learned in either the course and or the text. But I think they also appreciated having to gather the information needed to make the decisions, as well as the process for resolving a situation or problem. So those were things that they commented upon. We had such good responses, and they were, really forthcoming. They provided us some great quotes, which I thought I'd share. The first of which says, "Great real life examples as to what we might encounter as healthcare administrators. They're well done, realistic, and allow for simulated practice. I like the explanations of why asking a question in a certain manner may not be the best option. I love the videos. I felt engaged in the scenarios. I had no suggestions for improvement. It's a great program. I love that it's interactive. Very informative and interactive. The scenarios were fun and engaging. Challenging application of content, deeper learning." So I think that about covers the quotes we got, but I'd be very curious to have a look at your questions. So first question, how do these scenarios connect with the learning objectives in the chapter in the text for which they're associated? And this is from Harry Holt. Actually, they're not, while they're aligned to the content in the text, they're not really that closely connected to a specific text. There are learning outcomes, and so I think you can match the learning outcomes that are provided in the scenarios with the learning outcomes you have for your course. I hope that answers the question.
Suzanne, It's Arletta. That's how we did it, because in some of our courses we utilize your text, in others we don't. So that was part of our selection process for which scenarios we would use, is how closely they match the outcomes for that specific course.
Okay, great. That's helpful. Thank you, Arletta, for jumping in. Anyone else who wants to jump in on any of these questions, I welcome it. Is there any reflection and feedback once the scenarios are completed by the students? For instance, are they ever asked whether the scenarios enabled them to acquire the learning objectives for the associated chapters within the scenarios? Again, from Harry Holt. I don't think we necessarily asked that question, but I think that's a great question for an instructor to ask.
Hi, Suzanne, Michael, that's exactly what I was going to add on to. We actually, depending on how, if there's any questions or qualms about what was discussed, I will actually schedule a synchronous discussion time with the students to debrief on the scenarios. And what they're required to do is they're required to come with questions. I'm not just going to sit online and reteach the class for an hour. And we talk about, again, the objectives. We align our outcomes with AONL. And so it's important that they understand that they also have another outlet to discuss what could be the right answer, what could be a better answer. And so, yeah, we do actually offer them the opportunity in a synchronous classroom setting after the fact.
That's wonderful. That's a great way to address it, especially, where you're largely remote. We have another question here. Is it possible to fail? Are there keys for recommendations? I don't, based on what Steve showed you, I think as you go through the scenario, if a student asks a question and gets it incorrect, they'll know that it's incorrect, and they have to go and try another question to find the right question. And then as far as the assessments goes, the students can do the assessments as many times as they want or need to get them all correct. And in doing so, they probably learn the material by doing that. I'm not sure about the keys for recommendations. Steve, do you have anything else to add here, or anyone?
In terms of recommendations, the other an assessment afterwards, you also might want to build something into your learning management system in terms of asking students for their feedback on the content and whether things have been valuable at all. Is that the question that you're looking for?
Yeah, I think that definitely is a good addition onto what my response. If we didn't answer the question, please ask another one so we can address exactly what you're asking. Someone makes a comment there. This is an additional cost to the students on top of the book. One of your competitors has an unlimited plan, which is all-inclusive. Are you considering an all-inclusive price, as that would be more attractive to my students? I would struggle to ask students to purchase more than a book and traditional online resources. And that's from Greg Bauer. We're looking at pricing all the time. At this point, we don't have an unlimited plan, but it's something maybe down the line that would be a possibility. But I think $15 for really this robust simulation is not a huge ask, and I think they can really get a lot out of it. How many episodes are in each scenario product, and does each episode have an assessment and recommendation assignment? For each Navigate scenario, there are 4 episodes, and each does have an assessment. Steve, I'm not sure if there's a writing assignment with each one. Can you comment on that?
Yeah, some of the episodes have a writing assignment, some of them do not, and that varies scenario by scenario.
Okay, thank you for that. Somebody else says, is it possible for me to demo some of the scenarios before I got cut off? Wait, let me see if is it possible for me to demo some of the scenarios before probably adopting them? And I'm going to say yes. If you'd like to demo them, on my next screen, you're going to see some opportunities. We have a site then for the Navigate scenarios where you can request demo access, or you could reach out to your account representatives from JBL, and they would be happy to help you. Can you create a one price bundle? Yes, we can. We do, like I said, we bundle them for the text price plus additional 15. If you're going to do something creative, like picking from different episodes and different scenarios, we'll have to come up with a good bundle price that makes sense.
Suzanne?
Yes?
I'd like to say our rep worked with us to do that. We were able to do a bundle price, and we eliminated a textbook that had been previously required because we felt like the scenarios at the cost was brought so much more valuable to the students than that additional textbook. So what we paid for the bundle, we waived $145 textbook. So it was definitely well worth the conversation with the representative.
Yeah, you'll find that our reps are great at figuring out a good solution for, your program, and we'll certainly work with you to come up with a good solution. Thank you for jumping in. Do others use these in undergraduate programs? This is from Susie Booker Bassett. Yes, I believe these are used in both undergraduate and graduate level programs. So it really, probably depends on your course and what you hope to get out of it.
Suzanne, I teach only undergraduates, so it's definitely used in undergraduates.
Wonderful. Thanks for sharing that, Linda.
Uh-huh.
Can we use the scenarios across our nursing leadership track? For instance, one scenario in one course, another for another course? And this is from Michelle Kramer. Can I handle that over to you, Michael?
Yeah, that is exactly what I do. We bundled the whole package, and they use it. They're going, because ours is a 6-semester program, and they're going to have, I'm going to use the scenarios based on the courses that they're taking. So when they purchased the bundle, they purchased it for the entire 6 semesters, and then they have access to it on demand, and then I'll assign those particular scenarios in the appropriate course.
Wonderful. Thank you for sharing that. So the answer is yes, it's perfect for that. Can we access these scenarios to review them before deciding on purchasing? I would like to know how I would use them in my healthcare delivery course. This is from Scott Wisniewski. Scott, yes, and everyone else. The best bet is to really work with your JBL account rep, and they can make sure that you get the scenario that you're interested in this case, healthcare delivery, and have a chance to use it and see how you can use it in your course before making a decision. Of course, that's not a problem.
In fact, let me add one other thing, Suzanne. We actually have a demo suite of all of the scenarios, and so you could take each and every one of them, or whichever ones you want, out for a spin. Just reach out to your sales rep, talk with them, and they can set you up with demo access.
Thank you, Steve. Are you expanding on more virtual scenarios, such as for health information? Right now, we have the 8. We will look to, as we have demand, we will look to expanding. But more to come on that front. I can't really commit to anything at this point, but thank you for asking. We hope to. I want to make sure I understand the total cost to students. As I understand it, if we're using a JBL text in the program, we would have access to all the episodes and sections for only $15 per student. If so, that's great. Yes, if you, we will bundle it with a JBL text for plus 15 to what you're paying on your text. So it's the text price plus $15 for the scenario. And then standalone, if you were using it standalone, it would be $49.95 for, say, healthcare delivery, that scenario, or any of the other scenarios with those 4 episodes within it. Another comment here, we have definitely been looking for something like this. Are all students required to purchase the Navigate product with the text? With the text to participate? They would need to have the Navigate product along with the text to participate, because they're going to be going through it on their own and doing the assessments. Yes, they would need to have the Navigate scenario. What is the cost of the scenarios? I think I just covered that with a couple questions ago. Okay, here's Eileen cut back to us about the key points. I write key points for all of my grading. Do you include a key points list for the recommendation assignment that comes after the quiz? And this is from Eileen Alexander again. I'm going to turn it to you, Steve. Can you speak to that at all?
I cannot. I'm not aware of us providing any of that, but I haven't drilled into all of the instructor resources that we make available. It is possible that we have that, but I've not seen that to date.
Okay. Thank you. And I'm not aware of anything specific to that point. So we can explore that and hopefully get back to you on that, or maybe ping me after the fact and we can try to get to the bottom of that for you. Another question from Marissa Lejeune. How do I find out who my JBL rep is? On my next screen, you're going to have an address. You can go to our website. At the bottom of our screen, contact my rep is one of the options, but I have the actual address on the next screen, which I'll share with you in a few minutes. Does the students have a time limit to access it? No, the scenarios can really be done on the student's own time. It's not a timed thing. And you're asking it because students would share the program. Yeah, I don't really know how that would work, but there is no time limit to the scenarios. Okay, and let me see. I am a health information management instructor as well, and I would love to see a scenario on quality improvement. Okay. That's not the first time I've heard that one. So we'll keep that one in mind too. And she asked, so is it $49 for access to all the scenarios or for one scenario? So one scenario is $49.95. So one scenario has 4 episodes within it, and all of that comes for that $49.95. If you're using it standalone, if you're using it with the text, it's plus $15 in addition to the cost of the text. Are these being used later in a course or after students have required the bulk of the content in the course? Does anyone want to respond to that when you use them? Michael or Arletta or Linda?
Ours are just used whenever that outcome is introduced and that content is introduced. Then the discussion or the assignment will match with that scenario.
Same for us. Yes, exactly.
Okay.
I found that it's that the concepts are so general for what's throughout the book that I don't tie it to a particular chapter. It's more tied to timing.
Okay. Yeah, that makes sense too. So I think that is it. All the questions that we have today. So I am going to just give you my last parting screen with the contact information that I had mentioned. So if you want to find your account specialist, you can go to GoJB Learning, find your rep. You can also request a demo or request the demo suite at this URL here, which we have a dedicated website. This site also explains each scenario and what is covered. So it's really a great place to go to learn more about each of the individual scenarios. Also, feel free to contact myself or Stephen if you have any additional questions. I want to thank all of you for joining us today, and I really want to thank my presenters from Michael Leisure, Linda Martinez, and Arletta Wallace, as well as Stephen Webster for their time and sharing with us their experiences with the Navigate scenarios at their schools. And this ends today's webinar. I want to thank everybody for coming. Have a great rest of your day. Bye all.